This webinar is made possible by the Sentio Marriage and Family Therapy Program. Visit us at www.sentio.org.
Welcome, everybody. It's so nice to see all of you. Smiles out there. We are back with another Sentio webinar. My name is Jason Brand. I am a senior deliberate practice instructor at Sentio University, and we're here today to do another deep dive into the Essentials of Psychotherapy book series, which is published by the American Psychological Association. And today, I'm very glad to have once again with me Hannah Levinson. Hi, Hannah.
Hi, good morning.
Good morning.
Or
So
good
a quick,
afternoon or good evening, wherever you are.
yeah, or even tomorrow if you're like somebody said they're coming from where it's 4 a.m. So welcome and good morning. All right, so let's get into it here. First of all, and let's welcome our guest expert, Hannah Levinson. Hannah is a professor emeritus at the Wright Institute in Berkeley, California. She has specialized in brief dynamic psychotherapy for over 40 years. She has published over 85 papers and has written 6 books, 3 of which are on deliberate practice. And 2 of these, which we're very excited, are coming out in February, AEDP, and the other one, Hannah, emotionally focused couples therapy, correct?
Right.
Going to be such a great, both of those are going to be such great additions to the book series. So Hannah, back again. Hannah has been so wonderful about giving her time, and we're actually going to make our way through the whole book, through all the different exercises. So thank you so much, Hannah. How are you today?
I'm doing well. I'm always excited to do these things.
Yeah, I always love your kind of energy, and I know that you're a big lover of metaphors. So we're gonna have fun today.
They are close to my heart.
Yeah, you're already starting. I love it. Okay, so we are going to save 10 minutes at the end for questions and answers. So we'll have plenty of time for that. This webinar is brought to you by Sentio Counseling Center and Sentio University. Sentio Counseling Center, California and Washington. If you're looking for a place for low fee referrals, starting at $30 a session, sliding scale, great therapists, trauma informed, really cover the gamut in terms of being able to work with a wide variety of patients and presentations. So please send us your referrals, keep us in mind. We really appreciate it. We accept referrals in Washington State and in California. See the websites there. In addition, if you are interested, if this is something today, you like what you see, you're thinking about deliberate practice, really wanting to do a deep dive into it, consider our year-long residency program. And I'm what was the Hair Club for Men? I'm not only a member, I'm not the president, but I am a member of it. And I've gone through the program, and I can't say enough good things about it. You really do learn in a comprehensive way how to do deliberate practice. So if you're interested in that, reach out. We'd love to have you. Again, that's in California. And today, this is just going to be one slide on a little bit of conceptual learning before we get into procedural learning. And Hannah, I had a funny experience with conceptual learning, which was, so I was on vacation. I happened to have a little extra time. I listened to a psychotherapy podcast, which was really interesting and really just reminded me of some of my patients and reminded me of my work. And I thought, I listened to it. It even had some interventions that you could do. And I actually talked to a colleague about it. I was so excited about it. And then I get back from vacation, and I'm so excited to try out these skills with my patients. I sit down, I have all these great things formulated in my mind. They come out not so good, not as I had them in my brain. And it really made me think about this slide, which is that I had the conceptual piece of it pretty well formulated. What was missing was the procedural. which was that I hadn't really practiced these skills in, in a setting that was close enough to sitting down with my actual, excuse me, with my actual clients or patients. So that's what we're doing today. We're trying to hit that sweet spot where we all have a conceptual understanding, which is actually we're going to deepen today, of metaphors. And we're actually going to be working that procedural part where we're going to get a chance to actually practice this. So that leads us into the Sentio book series, which is really trying to target what Sentio and Tony Ruminaire and Alexander Vosch, who edited all these books and are kind of the main brains behind Sentio, this book series really targets this idea that psychotherapy training in general does not do enough procedural teaching, and there's not enough procedural learning that happens. And that's where this wonderful book that Hannah and her colleagues wrote comes in. This is, you can see it's the one with the most kind of colorful image there. It was written by Hannah and her colleagues Volney Gay and Jeffrey Binder. Do I have his last name right, Hannah?
You do, and I like thinking of it as the most complex cover.
Nice.
Jason, right? To
Yeah.
exemplify that this model of psychodynamic psychotherapy, this orientation, is so complex.
Yeah, and what a task. I mean, putting something that has such this rich conceptual history into 12 skills, which you can see them here actually. I mean, we've talked about it before, Hannah, but still it's just it's worth mentioning again. What was it like taking psychodynamic theory and practice and putting it into 12 deliberate practice skills?
Yeah, I like to kid that my hair used to be much darker. Yes, what we did is we had to take what would be the essence of psychodynamic therapy, skills that trainees had difficulties with, and kind of boil it down to 12 skills. And so we looked at the research literature, we looked at our clinical experience, we looked at empirical evidence, conceptual evidence, and these 12 seem to be the ones that kept getting mentioned over and over again. And so we have covered many of these in other webinars, and they're out there on YouTube for your interest, and also for any teaching and supervision that you might be doing with students. And today we're going to cover the 8th exercise using metaphors.
Yeah. Yeah. And metaphors, Hannah, I love the way that you guys wrote about it in the book. And you talk about them as being deceptively simple, but you also you also lay out how they're kind of a powerhouse in terms of as a way to connect with your patients, as a way to think about therapy. And I mean, so talk a little bit about metaphor as powerful for psychotherapy.
Right. Well, metaphors, as we all know, just captures so much of the essence, really, of what might be going on in the patient's mind, but that can't be directly expressed linearly with words in a nice, neat paragraph. And so usually metaphors convey such an emotional wallop, that kind of impact, that they're just imbued with so much feeling and possibility and ways of looking at things as only images can, as opposed to words. Picture is worth 1,000 words. So I love using metaphors. I think both in terms of understanding what patients say when they use metaphors, usually quite unconsciously, quite out of awareness. And I love using metaphors with my patients. Just yesterday, I was doing a couples therapy, and the wife was very removed and aloof in the session and being very defensive. And rather than commenting on her defensiveness, I said, it feels to me like you have a wall around your heart today, right? And that just opened things up. It got her husband to understand that she wasn't withdrawing from him, but there was something protective that she needed to do. And that allowed her to feel non-pathologized, etc. And so that simple metaphor of a wall, right, really enabled us to go much deeper and to really process something that otherwise would have been quite difficult.
Yeah, and I mean, we're going to get into this more, but I'm just curious, why would that be an easier way? What would make that more palatable, perhaps? And maybe it's contextual, but what made that more? What makes a metaphor more palatable, kind of, less intrusive, or what is it about metaphors that do that?
Well, I think it leads to possibilities. If I would have said something about her being defensive, she might have felt that was belittling of her. And in fact, the research seems to indicate those statements are often taken as belittling by patients. So you have maybe a rupture going on. I also think that they capture so much in that image that the patient can relate to. Right. And so it really does further the possibilities as to where you can go. And it allows me to say something that indicates, this is adaptive, right? That this wall was necessary. There's something you are protecting. You're not just doing it to, push your loved ones away. You're doing this out of survival reasons, out of feeling like you have to maintain some kind of integrity. And so it's heard, I think, in a very different way and allows the work to go further.
Great. Okay, so we've established that metaphors have this power. And then another really nice thing that you guys do, and actually this makes this exercise kind of unique, is that it's called using metaphors. And you talk about different ways to actually use metaphors. I love that idea. Can you talk us through what does it mean to use a metaphor in different ways?
Right. Well, as myself and co-authors were talking about, developing a skill exercise around use of metaphors, we really could see that this one exercise was going to have 3 skills embedded in it. There were really 3 ways that we felt we could capture to get across the idea of the skill. The first one is when a patient uses a metaphor, can the therapist stay within the metaphor, right, and join the patient in that metaphor to see and unfold really what might be the meaning of that for the patient and what might be just on the edge of awareness for that patient unconsciously. But then secondly, we could give a conjecture as to what we think the meaning of that metaphor that the patient has used pertains to. It sounds like you're saying, etc. Right? And so we can put forth some kind of explicit statement about what might be going implicitly for the patient. And then the third one, which I must say is one of my favorites, is using metaphors as the therapist. So you see something going on, and can you frame it metaphorically so that the patient can see it and hear it and maybe learn something in a new way about the implications of that metaphor for themselves.
Great, great. And today we're going to get to the first 2. We're going to walk through just kind of translate this and tell me if I got this right, kind of just staying with the metaphor as it was presented more by the patient. And then the second is kind of, if it's an iceberg, it's kind of going a little bit below the surface.
Right. To actually say, make it explicit what you feel that implicit metaphor is intending to convey.
Got it. Make it explicit. So there was something implicitly. I got it. Okay. Very nice. That's great. Okay. And I know we're not going to get to the third one, but then can you just run through the third one again?
Yeah, and that is that the therapist uses metaphors to capture what they see going on, kind of like my saying, you looks like you have a wall around your heart. I might also say, since in our previous webinar, we covered exercise 7, making transference interpretations.
Yeah.
And hopefully the participants here today can see the similarity. I'm told that metaphor is from 2 Greek words that mean carry over. So you take something that pertains to one object, one situation, right?
Mm-hmm.
And you then carry it over or transfer it to another object, certain aspects of that to another object. And there's where we get into that kind of transference of one thing to another that might speak volumes.
Huh. Oh, how nice. Okay, before we get to the exercise, I just have one more question for you is about, can you talk a little bit about alliance and about what do metaphor, and I think it was a beautiful example with your couple yesterday. Can metaphor help in terms of building the therapeutic alliance? And what can it do for the therapy process? That's kind of the other part to that.
Right. Well, of course, when you say things in a more meaningful, down to earth, but not antagonistic, not pathologizing manner, there's a greater chance that not only the patient can let it in, but that it will really help, with that therapeutic alliance, as the patient gets a sense, you understand what they're really talking about. In fact, they didn't really understand quite what they were talking about, but now that they've heard that metaphor, they say, oh, this person understands me. So that really helps with the alliance, both in avoiding ruptures and in letting the patient know you have an idea, or you're willing to put forth an idea about what's going on with them. And then, as we all know, we develop this shorthand communication lingo with our patients that now in the future, when this person walks in with her spouse, I can say, if I see the same thing, oh, you've got that wall up today, right? And so she knows exactly what I'm referring to. And you develop this very personal, very idiosyncratic language.
Yeah. It's so great. And this is what's so special about breaking down psychodynamic, psychoanalytic theory into these very approachable exercises is that, that's such a beautiful idea, and it's such a pro-relationship idea about building relationships and growth and development. And it's so nice to have it in this form. So let's walk through metaphors. And you're going to walk us through, Hannah, in terms of what are we going to do today? How are we going to do this? Let's take a look at an example.
Right. So we do need to develop skill criteria for the topic that we're talking about. For these 12 skills, we need explicit criteria so that we know what we're talking about and the trainee knows what we're talking about. And then how to do it, you would then have a way behaviorally of saying, yes, you did it, or no, you didn't. Yes, you met the criterion, or no, you didn't. And this exercise, this first one, only has one criterion. Ask a question exploring the patient's metaphor while staying within the metaphor.
Okay.
And so let's give an example.
Okay, so we got an example here. So the patient says...
Do you want to role play the patient, Jason?
Yeah, sure. So they look at me with piercing eyes.
And so now I, as the therapist, need to say something.
Okay.
So let's take a look.
Let's take a look.
When their eyes pierce you, what do they see? So I'm staying within the metaphor. When their eyes pierce you, what do they see? And that meets criterion number 1.
Fantastic.
So then we would say, now, of course, we're not going to do a whole full role play. I don't hear back from the patient. That would be something very different. But here we're just going to practice these. And in the book, you get to practice it 15 times in a different clinical scenario. And so
15
now,
times with 15 different therapist responses that are all there as well. So
right,
puts you in the ballpark. Go ahead, Hannah.
yeah, with different with different patient prompts, right?
Yes.
So you get to try it out with the patient saying this and this and this, but you still are trying to come up with that criterion to meet it. And of course, there are many possibilities. I'm sure people, the participants had very different responses here, and we're going to actually get to see what your responses are because we're going to try it out with you.
Right. So if you have this book at home and you have, you sit down with a colleague, or, you sit down with somebody outside of the therapy setting, right? And you can actually rehearse this. You have the criteria, you have, you play the therapist, and then somebody else plays the patient. And then you might have a third person, like a supervisor, who sits there and gives feedback on how it sounds and how you did, if you met the criteria. But today we're going to do something a little bit different. We're going to do this because it would be very cumbersome, as Hannah was saying, to do this breakout rooms and all that. So, and this has actually worked really well in the other webinars, which is that what we're going to do is we are going to give you, for example, I'll flip to one here. We will give you the skill is metaphors, the criteria, ask a question exploring the patient's metaphor while staying within the metaphor. The patient says, my partner's a porcupine. Now, what we would like you to do is to put into the chat, what would be, staying within the criteria here, what would be a response that you might give to this patient?
And we'll give you some time.
Yeah, go ahead. Anna, can we start with Deborah Baker's here? Which is, in what ways does your partner resemble a porcupine?
Yeah, actually, you might be anticipating the next use of metaphor, Deborah. If you were going to say that, not standing outside and say, in what way does your partner resemble a porcupine? But if you said, tell me about your partner, the porcupine, that would be just accepting that the partner is a porcupine, not resembling, because that would be, separating those two components. But if the partner is a porcupine, which the metaphor conveys, then how could you stay within it? So that would be my feedback to, I'd say, let's try it again. And I'd have you try it again and see if you could not say resembles, but actually accept that the partner is, and then get into it with the patient.
Great. Okay, let's try another one. How does it feel to try to get in touch with a porcupine?
Yeah, that's really staying within the metaphor, right? So now the patient might say things that they didn't even know really applied to the partner, or they may say things that are exactly what apply to the partner, right? You don't know which way it could go in anything in the middle, but you are staying within that metaphor with the patient. So I would say, yes, definitely meets criterion.
Okay, let's go one more here. What does it make you feel towards your partner when he, she, they is a porcupine?
Yeah, I think that would certainly stay within the metaphor, but I might want to just even make it crisper. So what does it make you feel toward your partner, the porcupine, right?
Huh.
So in other words, it's not just when they're a porcupine, because a porcupine is always a porcupine, right? So this is just little tweaking to make it crisper, trying to exemplify, this particular exercise. Of course, you could come up with different criteria for sure, but this is a bit of tweaking here that I would be doing with my trainees.
Great. And a question here, Hannah, I mean, this is sort of gets into the subtlety of deliberate practice. A lot of people in this particular one are kind of a step ahead in terms of the criteria. Why would you want to practice the version that's not further along? Why would you want to practice? I mean, it almost seems like, why would you want to practice the easier thing?
Well, easier, in one person's eyes is not easy
Sure.
in others. Uh, I think because staying with it leads to more possibilities that are outside awareness. When you ask someone to reflect on how is your partner like a porcupine, where do they go? They go into their conceptualizations, right?
Mm,
And they begin to talk about, which is very meaningful, as we'll see in the next use of metaphor. But if you stay within the metaphor, right, then I think the two of you might be finding out aspects that neither one of you were aware of. And there's often a lot of emotion that gets attached to it. For example, when I said to my patient, sounds like you have a wall around your heart today, she just started crying,
mm,
right? She didn't want to have a wall, but she did have a wall. And it just, came to her as an image and had a lot of emotional impact. So, but
yeah.
let's take a look and see, just as an example, now in the book, we do have at the end of every exercise what a therapist could come up with, right?
Great.
If you wanted to cuddle up to this porcupine, how would you do it?
Okay. Great. Okay. Should we move along?
Yeah, we've got
All
a
right.
few more of
So
these.
we got another one. Again, we're staying within the metaphor, asking a question. I carted around so much baggage from my previous life. So if you could put in the
Okay.
chat, what would you say here?
Again, we'll give you some time. These are great.
Yeah. When you're ready, Hannah, why don't you just pick one?
You got the idea for sure, right? Um, what does your baggage look like? How do you carry this baggage? Tell me what's in those bags. I love that one. These are fabulous. Sounds heavy and exhausting. How does it feel to bring the baggage with you everywhere, right? These are all great.
Yeah.
Yep. Yep.
What I love about this, I mean, we obviously can't get the emotion. We can't get the sort of, how you deliver the question within the text here. But I really loved what you said about you can start to see how this kind of just names the emotion, names the possibility of where are we going to go with this metaphor to help help open it up emotionally, just staying within it like this. You can
Right.
really
And I
get the
think
sense.
the variety of these answers, right, shows that depending upon the context and where you are with this particular patient, you would maybe ask a different kind of question, more honing in and focusing on what you think might be particularly relevant for them. So this is where you get into really, taking the skills and then beginning to apply it with some sophistication.
Here's an interesting one, Hannah, that I want to get your take on before we move along. Where do you feel this baggage pressing on your body right now?
Wow. Fascinating, yeah. And I mean, once we get into the body, that has all other kinds of implications for, metaphors and also for actuality. We talk about things, weighing on our shoulders, right? We talk about things that are in our heads and giving us headaches and so forth. So I love the combination with the somatic.
Yeah, cool. All right, let's see what you want to read out the therapist response here?
Do you have to carry those bags all by yourself?
Nice. Nice nod
Again,
to
no
the
right or wrong answer here. The only thing we're trying to judge is, does it meet the criterion?
great. Wonderful. Okay, let's do one more of this criteria. Staying within the metaphor. I feel like I'm in the last act of my life. We'll give you a little time. All right, you want to hop in here?
These are so clever.
So
See,
clever.
metaphor is so
I love
much
it.
fun, right? These are so clever. For
Uh-huh.
the supporting characters, yes, really staying within the metaphor. Do you always feel like you're acting?
Hmm.
Great. What role do you play in this act? Fabulous, fabulous. Do you know the ending, or are you still writing the script? These are all marvelous. I could just see them opening so much, fabulous energy in a session. So you've got the idea.
Yeah, and my favorite, the one that tickled me was, would you like there to be an encore?
Yeah,
It's the
right.
criteria.
Absolutely.
Great, great.
Absolutely. Right.
Okay, wonderful. All right, and you can see, I mean, again, just the variety. I mean, deliberate practice sometimes gets dinged for being cookie cutter or robotic, but you can see, I mean, just with the flavors of the answers, how unique this can actually be as we start to practice it. So
Right.
let's
And I
move
think
on.
there'll be the therapist response here.
Yeah. Oh, the therapist response. Fantastic.
What is the title of the play that is your life?
Nice. Okay. Ready to move along, Hannah?
Absolutely.
Okay, let's do. Using metaphor. This one has 2 criteria. You want to read these, Hannah?
Sure. So now we're getting into that second way of using metaphor. The first criterion is tentatively say the implicit message behind the metaphor back to the patient. And of course, there could be many messages, right? But say the implicit message back to the patient. And then ask the patient if that sounds right. And we've added this second criterion because, of course, you're going to conjecture that message.
Mm.
Chances are you could be off, right? And then rather than coming on high, like you as the expert therapist, telling the patient what the metaphor means, you are going to ask. So first of all, you're going to say it tentatively, but then you're going to ask, did that ring true? Did that sound right? Did that make sense?
Yeah. So let's
Look
look at
at
an
an
example.
Yeah.
Go ahead. So, same one. Ooh, they looked at me with piercing eyes.
So you'll recognize this from the exercise before, but now we're going to say what we think is the implicit message. That makes it sound like you are so vulnerable in their presence. Is that the way it feels to you?
Hmm. So it almost sounds like more like an intervention, or like you're an intervention. Does that sound right? Like one is more a question and the other is sort of more of an intervention. Am I on base with that?
I think of them both as interventions.
Okay.
I think this one is a conjecture, right?
Uh,
And the other one was really asking an open-ended question, staying within the metaphor. So here you're making a statement, you're conjecturing, you're making an educated guess.
yeah, that's a better way to put it. Okay, wonderful. Great. Well, let's take a look at an example that everybody can try. So going back to that same one, doing it a little differently this time with the implicit message behind the patient statement, and ask the patient if that sounds right. So, ooh, my partner is a porcupine. I'll give you a little time here to put in, what would you say to this using these criteria? It's so good. Each one of them.
Should I jump in?
Yeah, please do, Hannah.
Yeah, so I love the one. It must be so painful to get close. You need to be so careful. Do I have that right? Right, that definitely meets the
Yeah.
criteria. You're trying to get to the essence of the meaning. Let's see, it sounds as though at times it may not be safe to approach your partner. Does that ring true to you? Absolutely meets the criteria. Sounds like you feel scared of them. Is that right? Right. Now there was one, I wonder if you've been stuck by one of
Yeah.
bills and it's causing you to pull away. I would say that would go with the previous example that we did, where the exercise was to stay within the metaphor, right? Because hopefully the real partner does not have quills. And so although who knows, but so I would see that as staying within the metaphor as opposed to now stepping back and saying, oh, you really have to be so careful.
Hmm.
Have you been hurt? Right. So
Let
that
me ask you
again,
though, Hannah, on that one, but what about the you've been stuck by? I mean, is that
well, you've been stuck by a
by
quill,
one of the quills? So,
but that's staying within the metaphor, quills, porcupine, as
ah,
opposed to sounds like you've been really hurt by your partner.
ah, okay, that's super helpful. Thank you. Yeah, that's great.
All right.
Okay, just one last, I'm just curious. Maybe they're just afraid to get close. Sound familiar?
Uh-huh. Huh. Right, right, because that often happens with porcupines, they show their quills when they're afraid. Right, great.
Right, and the conjecture is that maybe you're like your partner. Maybe there's a connection between you and your partner in there. So I can see the conjecture in that.
Well, actually not. Maybe they're afraid to get close. So they're really just helping the patient, I think, understand what's going on with the partner.
Mm,
They're not really saying anything about the patient, other than they might be, you know, their partner might be afraid to get close.
uh-huh. Okay. Yeah, interesting. I read it a little different, but huh. All right. Well, let's keep it moving here. Let's see what the therapist response is. Go ahead, Hannah.
Very much, as many of the participants, it sounds like you need to be careful around your partner. Is that your experience?
Great. Okay. Moving along. Let's do another one here. Same thing, different criteria. I cart around so much baggage from my previous life.
I'm going to start commenting. Yes, burdened and held back by the past. Absolutely. And then asking, does that ring true? Sounds like this is exhausting. Does that sound right? Really overwhelmed. So here giving meaning. And how the one I'm laughing about is there's a lot from your past that is weighing you down. Right? And the reason I'm laughing at that is we use so many metaphors in everyday language that
Right.
we don't even realize it's a metaphor. So in some ways, this is staying within the metaphor, baggage weighing you down, so you're staying. But on the other hand, we use it colloquially, right?
Mm,
This is weighing you down, right? And so
yeah.
it conveys a meaning. So that just shows you how metaphors are so much a part of how we speak. It really, they capture so much. So these are excellent.
These are excellent. I'm going to read you one. So much from your previous life is holding you back, weighing you down, keeping you from being fully present in your current life. Am I getting a little of what you mean?
Excellent. Excellent. It's very full. I would imagine you know quite a bit about the patient, right? This
Hmm.
might not be the thing you would say in a first session, but now you can put it together and use the metaphor to have it hit home.
Right. Okay, let's see what the therapist response is here. I cart around so much baggage from my previous life.
When you say that, it sounds exhausting, is it?
Nice. Okay. All right. Let's go one more before we open it up for questions. I feel like I'm in the last act of my life.
These are wonderful.
Yeah.
Mhm. Right, I'm going to jump in.
Go for it.
Yeah, sounds like you're ready for a new phase. Is that right? I sense a sense of grief and fear, grieving your mortality, right? So little time. And this comes with a tugging of sadness. Beautiful, beautiful. And then, of course, yes, check in with them, see. So excellent. I think these all meet the criteria. Lovely.
Yeah, you've got my ear so tuned to it now. I love this one. I hear that you feel hopeless and lost in this particular scene, and you don't know how the plot will progress. Does that sound accurate? So staying within the metaphor, but also kind of building on the metaphor to,
Yeah.
to
Right, and
get
this
at the
is
implicit message.
combining, right? This is really combining skill we just did, stay within the metaphor, but also conjecture and combining. And we find this happens, as the person is using more and more skills. Of course, the more sophistication you have as a therapist, the more capacity, the more experience, you're going to start melding these. You're going to combine them, right? And that's the whole idea, actually, not to just have a silo skill, but to begin to embed this in the whole context of the therapy.
Yeah,
Lovely.
it is lovely. And just one more thing is you such a sense of play within this exercise. So much playing with language,
Yes,
and an opportunity to play with your client's patients with language using metaphor. So
that's
let's
right.
just take a look. We're not going to be able to get fully into this today, but this is, I want to look at the final third one that we're not going to get a time to do today. Do you want to set this one up for us and talk about it a bit? Oh, but before I do
Right.
that, let me go back and give you the therapist response. Sorry about that. Go ahead,
Oh,
Hannah.
I think everyone's was so excellent. It
Okay.
sounds like you feel most of your life is over. Do I have that right?
Right. Okay. So let's get into this one and give us a sense of the third using metaphor.
Right. So this is where the therapist uses the metaphor. So the first criterion is tentatively use a metaphor that captures the meaning of something the patient is saying. So now you have to come up with the metaphor and ask the patient if that sounds right, because of course you're again trying to conjecture a reasonable metaphor. And we have an example. Did you want to be the patient?
Sorry, I lost sound here. I always try to be happy.
And then the therapist could use a metaphor. Sometimes I picture you painting on a smiling face, even when you feel sad. Does my image resonate with you in some way?
Nice.
And again,
Okay.
we don't have time to practice this one, but my guess is you all have your favorite metaphors if you've been in practice any length of time.
Yes, and if you would like to, you can certainly put questions in the chat if you'd like to share your favorite metaphors. We'd love to hear from you on that. If you want to come on and just ask to unmute, raise your hand, and we will let you in. Or if you just have a general question for Hannah about metaphors or the book, let's open it up. While we're waiting, Hannah, my daughter and I, we were driving by a yoga studio. We happened to pull over for something. We overheard two people talking to each other, and one said, "You know what? It's not my monkeys and not my circus." And that one, my daughter and I, we laugh about that, and we say that to each other all the time. Not my monkeys, not my circus.
So I see a question here. What
Yeah.
happens when a person does not understand the metaphor? Yeah, you could imagine, where could you go? You could, of course, ask them what it felt like that you used that metaphor in case there was a rupture. If you're so far off that the metaphor is confusing, or they don't understand where you're going, or maybe they think it's weird for you to do this, then that might be a rupture, and I would really want to try and do whatever I could to repair it. So I would want to understand, where their difficulty is, or I could own it and say, it sounds like I'm really off base. Is there something that you feel comes closer? So it's the beginning of a dialogue around that is how I would use it. It
Yeah,
would
and the
show
way
me that I wasn't, maybe my empathy or my capacity to understand what they were using, what they were saying was off.
yeah. And in
And
the
it
book
might
you
be
have,
cultural. I'm sorry for interrupting, but this is an important point.
yeah, sure, go.
Say it enough, that this could be cultural, something that's so typical to say in our culture with a different background, different culture. It doesn't compute, doesn't make any sense. In fact, sometimes when I am working with someone and I know there are those cultural differences, I might preface it by saying, well, where I'm from, we talk about carting around a lot of baggage. Is that something you would say, right? So just be aware of that.
Yeah. Yeah, and in the book, the three uses of metaphor are broken down into beginner, intermediate, and advanced. And the third one, where you're actually coming up with a metaphor, is actually the advanced skill.
Right.
So, I mean, you're obviously safer if you stay within what the patient had said, as opposed to venturing out into your own use of metaphor.
Yeah. 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 Like my patient could have said, "What do you mean a wall?" Right? Like, what do you mean a wall around my heart? Right. And then I would say, it sounds like that really didn't fit for you. That doesn't work, and to again get into what's going on for them. And quite often, as we all know in therapy, not only is it grist for the mill, but it leads to such productive arenas, I find.
Yeah, here's an interesting question. Would you recommend this approach to clients on the autism spectrum? Would you modify anything for this population?
Oh, wow. What a good question. That's outside my area of expertise, I must say right there. Although I'm very interested in alexithymia of late. And I think you need to be, this question is so sophisticated. You need to be sensitive to, what is the capacity of your patient? Are they very concrete? Do they not understand or able to verbalize feelings? So to be able to take that into account as you're trying to have the best intervention possible, I'd be listening very acutely for, is there a use of metaphor, which is kind of an as if, or is the person so concrete that they mean that as the thing itself, right? And to be kind of tracking that. So I think that's an excellent and very sophisticated question that obviously any of these skills need to be appropriate for time, place, context, and characteristics of the patient.
Yeah, and I do think there's something here culturally, again, going back. I mean, metaphors can be incredibly racist. They can be incredibly sexist. They can be outdated in terms of the way that we talk to each other. And so I do think that there's this does come with a bit of a, note of caution about your, like check your metaphors before you just throw them out there if that's something you're going to do in session with your patients.
Let's see this yeah.
You want to read this one, Hannah?
Let's see, situations I've seen are where people are 98% okay with their job, but feel 2% is driving them to frustration. I use something along the lines of ordering a specialty coffee and being upset that the outside of the disposable cup had a scratch on it. I do this as a way of exploring and not invalidating. What would be your feedback on this kind of example? Yeah, I think, see, this is so lovely, exemplifying how to say something that otherwise might be very alienating or pathologizing with something that hopefully the patient could relate to. ordering this and then paying attention to this minor aspect. So yeah, I think it sounds great. And of course, this is where the responsiveness and the resonance, and most importantly, the attunement happens. If you try something like this and it just flops, it does not go over, then of course you're not being attuned, and it's a corrective. It isn't like we're expected to hit the nail on the head every time, right? So it's a way to learn as we go through the process of getting to know someone.
Right. And all of this, again, that's why we practice. That's why we gather as a group of therapists in this forum. And that's what the book is for, in terms of really getting to try these things out. And in an environment which has some pressure. I mean, there's some pressure in writing into a chat box here your intervention, what you wanted to say, and trying it out and seeing what it feels like out in the world. So that's really what we're experimenting with today.
Oh, I'm afraid our time has come to a close.
Our time is up.
So much fun. Thank you.
Yeah, the next one, Hannah, you and I are getting back together in October, middle of October, October 15th, which is a Tuesday, a little different, 9 a.m. PST. And we're going to do fantasy. So that should be interesting. So please come join us then. Actually, and then I'll be here next week doing motivational interviewing with two wonderful guests. So if you want to tune in, actually it's 10 o'clock next week, but come on back. We'd love to have you. Thank you so much. These were fantastic. You all clearly know what you're doing here, and we so appreciate it. And thank you, Hannah.
My pleasure.
All right. Bye-bye, everybody.
Bye.
This webinar is made possible by the Sentio Marriage and Family Therapy Program. Visit us at www.sentio.org.